Hi guys, and welcome back to another episode of Mondays with me, Dr. Crystal. So if you guys thought that we weren't going to talk about Zion Williamson this week, you were way wrong. This past week, the best player in men's college basketball, probably the #1 NBA draft pick, went down during the first minute of the biggest game of the year. If you've been on my channel a while, you know that sports medicine is my passion. Basketball is my sport, so this injury is my jam. Those of you who have been here for a while may also know that I did my sports medicine fellowship at Carolina. So I loved the result of the game. It definitely would have been better to beat them with Zion, but I'll take it. Even though I was cheering for Carolina, I never like to see any athlete go down, so I am really hoping for him to make a full and quick recovery. So anyways, let's talk about this injury. So I probably watched this video like 30 times already, but let's watch it one more time.
Here, his foot comes out of his shoe. That's unbelievable.
He broke his shoe with his own foot, but as you say, the injury does not...
Look at his left shoe. He blew completely through the shoe.
Now, I am a huge Nike fan, but what the hell? Dude's shoe literally exploded. I'm gonna stand on my couch so you can see this. So his left shoe kind of exploded and his foot went this way and his right knee kind of went this way, pushed in like this. So as soon as I saw that, I was really worried about his MCL just because of the way his leg went in like that, and so we call that a valgus force on the knee. The way I learned to remember that was that Gus kind of sounds like gum, and gum makes the knee stick together, and so when they make that motion, it's called valgus. So Zion heads back to the locker room during the first minute of the game, and he never comes back out. And we really don't hear anything else besides he's out with a knee injury. The good thing was he popped up right after that injury. He walked off the court on his own. He was limping maybe a little bit, but overall looked pretty good. So the next day we get report that his injury is a grade 1 knee sprain, and he's listed as day-to-day. Now hold on a second. I don't know if you guys know the definition of sprain, but I do. And sprain means the stretching or tearing of a ligament. Have you heard of a ligament called knee? I haven't. So they're being very vague with this grade 1 knee sprain. I just assume by watching this injury that they are referring to a grade 1 MCL sprain. I'm pretty positive that's what's going on with him. And so we are going to talk a little bit about that. Essentially, when someone sprains their MCL, we grade it 1 through 3. And now I'm going to show you an example. So, I got a stretchy thing here. Ligaments aren't quite this stretchy, but we're just gonna pretend, okay? So, the MCL kind of goes along the middle of your knee here, and it protects against that valgus force that I was telling you about. So if I grab somebody's leg and I push it that way, the MCL is gonna stop it from keeping going that way. And so, grade 1 MCL sprain. So in a grade 1 MCL sprain, the fibers get stretched, there may be a few fibers torn, but when you stress the leg this way, it's gonna stop. You're gonna have an endpoint because that MCL is still holding the knee in place. From what they're saying, that is what Zion has. It should be a pretty quick recovery. A lot of times we diagnose these without even doing an MRI. Because he's Zion Williamson, I'm sure he got an MRI that showed that it was a grade 1 MCL sprain. So basically treatment for that is gonna be rest, a little bit of therapy, and most people can return to sports within about 5 to 7 days. Grade 2 MCL sprain. Here we have our MCL. So that's not exactly what it's gonna look like. Usually the fibers are gonna tear going this way, but, ooh, that's a grade 3. I'm gonna make another cut in this half here. So grade 2, a few more of these fibers are torn. It can stretch a little bit more, and so when you do that valgus stress test this way, you're gonna feel a little bit of laxity when you're testing that ligament. So the best way to know if a ligament is lax is to feel the other side. Most people have 2 legs, and so you can go ahead and feel the non-affected leg, and if the other side is stretchier when you test it, that's a sign that the ligament is torn. Treatment for a grade 2 is going to be similar to a grade 1. You're going to do some rest, some rehab. You might do some bracing to keep your knee from going that way because the ligament is a little bit more lax. These people with grade 2 injuries are not going to need surgery, and they usually recover really well. All right, grade 3. We already saw the grade 3 when I accidentally tore through, but grade 3. So grade 3, this one is clearly a lot worse. A lot of times these people can still get by without surgery though. So what we'll do is we'll put them in a brace with their leg nice and straight, locked in extension, and a lot of times the MCL can heal itself up. Sometimes they do require surgery to reattach, and obviously that's gonna be a longer recovery. So what's gonna happen with Zion? So right now when I'm filming this, it's Friday. They already said he's not gonna play in the game tomorrow on Saturday. They have another game on Tuesday. I think a question that a lot of people have is not whether or not he could be physically ready to go for the next game, but whether or not he should actually be playing. And the reason for that is he's probably gonna be the #1 pick. He is risking getting hurt again and losing whatever money comes with his NBA contract. That being said, I think he'll be back. I think he'll want to be with his team, lead them into March, and make a run at the championship. Now me, I can't stand Duke. I hope they lose, but I hope they lose with Zion back playing and healthy. And I'm very interested to see whether or not Zion signs a shoe contract with Nike. Alright guys, that's all I have for you today. I hope you enjoyed the video. If you did, don't forget to give it a like, subscribe if you haven't, and I'll see you next week.